was actually quite interesting. It kind of told me that I had increased risk of certain cancer.
Wow.
Yeah, and
that's
now I know that I can go.
Well, you're aware of it now.
So this is not really a new technology. You know, we've had genetic analysis and genetic the ability to map our genes for many years now. I think it's about the utility of it and what information could we glean from it. And more recently, we've been able to get data on the actual outcomes of certain gene properties. So we can say now that, you know, with the clinical trials, there's been good publications suggesting that we can pick up 10% more diseases than the normal guidelines. So now it actually makes sense to start using these kits, these tests to look at certain gene elements and say, do you have an increased risk? And they've been validated in more clinical trials. And so it gives you more faith to kind of give those recommendations to patients.
And it's pretty simple, isn't it? It's just a swab of saliva?
It's not a swab, it's actually a saliva test. So you have to just basically muster up a whole bunch of saliva and fill up the little tube to a certain level, and then you give it back to them, and it just kind of does it. It's very simple. There's no invasive component, but there is a blood test component to it as well. So we take a blood test to get your basic bloods in terms of your cholesterols and whatnot, and then they kind of pair that with the genetic data that comes back.
And what are the benefits of having this type of test?
The benefits are that you can figure out what diseases you have at a much earlier stage. So we recommend that perhaps anyone over the age of 30, I mean, in terms of prostate cancer, breast cancers for women, lung cancers, all these diabetes, heart disease, and it gives you a nice risk score compared to the average based on your specific genes. And the other thing is it actually tells us about your genes for the medications. So if I was to give you, say, perhaps one of the most common drugs for blood thinning post-heart attack, we know that there's 25% of people that are non-responders in this area. And we wouldn't have known that if we don't do the test. So we basically going blind by giving these patients blood thinners that may not work for them. And so knowing that information beforehand seems crucial to me.
And I know it's only in its early stages, but so far, what reaction have you had from patients, or when you've been doing the tests? How fascinating has it been, I suppose?
Everyone's really excited about it. Everyone's really fascinated. It's I think the first of its kind in Queensland for sure, and perhaps Australia in terms of the way that we're organizing it. It's just the first phase right now where we're trying to see what the feasibility is. Is it worthwhile doing? And then we're planning to make it like a one-stop shop where we can actually do personalized medicine, you know, incorporate longevity studies and try to get people to where they need to be.
And in terms of, from a doctor's perspective, how important is early detection? Because this test is an early detection, really. It's letting you know.
I think early detection and prevention are the cornerstones to all of medicine. You know, always going back and trying to fix a heart attack is much more difficult and can cause damage already. If we can prevent it, that's always the better cause. The problem is that in a healthcare system that we have, because of the money that it would cost to screen everybody for a test, it's not practical to do. And that makes sense from a health perspective, from a government perspective. But for any individual, if you have the means to go ahead and get that kind of test done, it's always going to be better for us to be able to detect diseases earlier. And they're doing that all over the place in Europe and America, you know, where they don't have public funding that kind of governs what tests you do get and don't get.
And I guess for a lot of people, knowing that they have because it's in percentages, so knowing that you may have an 80% chance of having breast cancer, do you think, I mean, that information can be quite daunting, but do you think it's also, I guess, handy to know as a person, as an individual?
I think it's a individual choice, and it's something that you have to come, you know, we'll do extensive counseling before we do the test to understand what the implications are, because some people, you know, do want to know, and some people perhaps they want to live a life where they don't want to know. But if you're the kind of person that definitely wants to know, and especially for certain things like breast cancer, where we can do something about it, we can do prophylactic mastectomies, or we can go screen much earlier than normal, and we can pick up things before it spreads. I think it's very useful.
And in terms of, because from what, you know, this precision medical clinic is kind of a world first. Do you think it's exciting that it's developed here in Australia, that we're kind of leading the advancement in this?
We're really, I think, at the forefront of where the technologies are taking us now. You know, we're actually in a space where we're utilizing the technology that already exists and actually utilizing it to help people. You know, actually packaging it in a way that's useful and can be utilized in terms of hard outcomes.